So the Violence Against Children survey, this was conducted in 2019. It proved to be a very, very useful tool. I must say that this is a second one that we've had in Kenya. We were lucky enough to be one of the countries where we had a repeat exercise. And right from the start of the Violence Against Children survey, at least the findings are able to give us the difference between the previous one, 2010 and 2019. So be able to get that picture. Has VAC actually reduced, or what is happening to VAC? But this one particularly was interesting for me because I was part of the protocol writing right to implementation and report writing. What it was able to define is, number one, who are most affected in terms of age set, in terms of sex, between boys and girls in Kenya. Number two, it was able to clearly define the context under which violence occurs in Kenya. And this is within the home setup, in the community, and within the schools, as children are out in the playground. So we're able to get a very clear picture of where this violence against children acts tend to occur, particularly sexual violence, which is the most atrocious type of them all. So it was able to give us a very, very clear picture of where this violence occurs, right to what time of day this violence occurs, who the perpetrators are that do this to our children in Kenya. And then the third component that it was able to give us. So the first one was the prevalence of violence in Kenya, how badly it affects our children. The second was the context. The third was how responsive are our health services, and not just for health, but our multi-sectoral services. So this is the social and welfare sector. For the police, how responsive are they to child survivors of violence to go to seek services from them? What I found fascinating about this is, as adults in the policy world, as researchers, we always have this way of thinking of how violence occurs. But the unique thing with the VAC survey was it was at population level, and it's the children who are actually reporting what their lived experiences and what they go through in their day-to-day life by the questions that we were able to ask. So that really, at least from our perspective in Kenya, it opened our eyes to some of the assumptions that we might be making towards the services that we provide for children versus what the children actually say about these services. So it was able to give that very, very clear picture of what children under 18 are going through in Kenya. And the best thing about understanding what they go through is that now the next level would be coming up with very responsive care package for them, either towards reducing the vulnerabilities that they're going through or responding to their needs for those ones who have unfortunately gone through that event. So the VAC survey was able to give us that clear picture. And of course, the comparison, being able to see whether VAC declined, VAC increased between the first VAC survey and the second 2019 one. And the important thing again about this VAC survey and that comparison is that we were able to see what efforts the government put in to be able to see the reduction. Because like in our case, we actually got a reduction in VAC overall, and even by the types of violence. So this second one was important in us, appreciating that as implementing partners, that as the government, that as development partners and the investment that has been made into it actually made a difference for the children by the proportion or by the prevalence that was reported in the second VAC.